Guys, welcome to my video on PLAB Obstetrics. This is my second video, and I will be going over ultrasound. So, if you want to know when the earliest it is that a pregnant woman can have an ultrasound, that's around 5 weeks. And at this point, the viability of the pregnancy and the location can be ascertained. And of course, a rough estimate of the dating can be done. However, you would only do it at this point or any time before 11 weeks if the patient comes in and reports bleeding or pain. And of course, the symptoms of bleeding or pain in a woman early on in a pregnancy make you suspicious for ectopic, make you suspicious for a missed abortion or miscarriage, and of course, these are of paramount importance that you need to determine the location and viability of a pregnancy. However, there are other instances, like if the patient comes in and she has a fundal size that is discrepant with her dates, the date of the last menstrual period. So she comes in and the fundal size is quite large, or she has severe vomiting, like hyperemesis gravidarum, you would suspect a molar pregnancy, and that's definite indication for doing an early pregnancy scan. If you suspect twins, again, if the fundal size is disproportionate to when the last menstrual period was, again, you're going to get the early pregnancy scan. So if you want to know what is usually offered to a pregnant woman, there are two scans or two ultrasound scans that are offered to a pregnant woman. The first is a dating scan, and that dating scan is usually done after 11 weeks. There is a parameter that can be used, or a measurement that can be used from the scan that you get to determine the estimated delivery date. So the crown rump length is usually the best measurement between 6 to 12 weeks. So if you're at 12 weeks gestation and you get your first scan, the crown rump length is going to be the measurement to which the EDD is going to be determined. However, if you are later on, so if you get the scan done 14 weeks, between 14 and 20 weeks, it's going to be the biparietal diameter that they get the EDD from. If you are a patient who comes in and you're in your third trimester, you're going to have to get 2 scans. So 2 scans 2 weeks apart if you come in your third trimester for the first time. So if you get this scan done between 11 weeks and 13 weeks and 6 days, it can be analyzed for something called nuchal translucency. So the more translucent the nuchal fold is, the greater association that has with certain malformations. And what they've done now is created something called the combined test for chromosomal abnormalities. So they take that nuchal translucency plus 2 lab tests, one of which is a free, what they call the free HCG, and a pregnancy-associated plasma protein A, plus the mother's age. And this is supposed to have a high detection rate for trisomy, a very high detection rate for trisomy 11 and 18. The detection rate using this method for trisomy 21 is it's under 90%. With these two, it's higher. So it's a very good method. And of course, between 18 to 22 weeks, there's something called an anomaly scan, which can be offered to the mother. And it's a very variable, very different kind of ultrasound because there's so many different things that can affect it, especially obesity in the mother, the skill of the operator, and how specific they are. So you really, when you get this scan, it needs to be really detailed for the structure, and in certain parts of the body, like the heart, this scan is not as good. So for a central nervous system structural anomaly, it's going to pick it up quite well. For a cardiac defect, it's not going to pick it up as well. And that's why usually after an anomaly scan, to pick up a congenital structural anomaly in the heart, you're going to follow that up by an echocardiogram. So thanks for watching my video. Please subscribe.